sure that you are kept on mute throughout any of the presentations. And I'd just like to remind everybody to be putting their questions into the chat that they will then later be addressed towards the end of the conference. Unfortunately, due to these technical difficulties, we have made the decision that we're going to leave out the break. I'm sure that you're all extremely busy people, so we wouldn't want to keep you any longer than we have to. But without further ado, we're moving swiftly on to our third session about preparing your physical health. And this will be presented to us by Dr. Abayomi Salawu. Dr. Salawu is a rehabilitation medicine consultant with the Hull University Teaching Hospital and NHS Trust. He is a senior clinical lecturer with the University of Hull Sports Science Department and a clinical lead on major trauma rehabilitation for the Hull Major Trauma Centre, North Yorkshire and Humberside Major Trauma Network. Dr. Salawu is also the lead clinician for the Humber Coast and Vale Health and Care Partnership. Please welcome Dr. Salawu.
Hello, thank you very much for the introduction, Kofu. I know we said we're not going to go into a break, but I won't be talking about physical activity if I don't get you to do some exercise. So for the next 10 seconds, I want to see how many people can stand up and sit down, and see how many you can do for 10 seconds, how many stand up and sit down. That's quite good and important because it's a way we can actually get these up and going. You'll be sitting down for the past 20 minutes. Okay. While you're doing that, not sure why the screen is not. Okay, yeah. So I'll start with this few quotes on exercise. I think the one I would like you to actually pay close attention to is the middle one by Edward Stanley, who basically stated that those who do not find time to exercise will have to find time for illness. And I think that basically sums it up. Exercise is everything. All the previous speakers have actually made my job fantastically easy because what they've all talked about can be embodied within physical activity and exercise. And I will go over trying to show how this links in, especially with the ongoing pandemic that we have. I know the theme of the conference is talking about the next pandemic, but in all honesty, we're still in the middle of one. And currently in the United Kingdom and Europe, we're in what we call the second wave. And in some parts of the world, they never actually left the first wave, like in the United States of America. The outline of what I'm going to be talking about is as listed above there. What we really actually need to know at the moment, Professor Fallacy talked earlier on about people living longer. If we look through history, this is actually arguably the best time in history to be alive. I know it might not feel like that at the current time with the COVID and everything in there. This is the period in human history people are living the longest. And I'm talking of the larger percentage of people. So on average, people have been living 6 years longer for the past 10, 12 years. And that's kind of almost peaked in advanced countries with people living, females 82, males 78. And in 6 of the 6 zones of the WHO, 5 of those 6 zones are chronic diseases, because as people are living longer, we're now having more of chronic disease rather than communicable diseases. Whereas in developing part of the world, which is only one zone, communicable diseases still remains. So we have come a long way. And we really, I think one of the biggest problems with this COVID is the fact that it is actually impacting on the fabric of what makes us human, which is social aspect. We are social animals, and one of the things COVID has done is to eat at socialization, and that's why it's been very difficult for a lot of people and for everybody generally and the society in total. So in terms of as we're getting more modern, what are we saying? Like I said, there's a lot more chronic diseases. But why, if we're living longer and we've still got the ability is there, but we're not using it, why is it still being preserved? Because if you follow in terms of what we talk about evolution and the genetic traits, you either use it or you lose it. But our exercise or physical ability capacity is still preserved, and it is a survival function. So historically or in evolution, it helps animals to escape from danger. Nowadays, we don't have to chase after our food. We eat a meal that has more calorie than a whole family of early people ate, and one person eats that. Before that is digested, we're on to our next meal. So a lot of things combining to affect the modern man. In terms of exercise and physical activity, people define all these things in different ways. And borrowing from what Professor Policy earlier said, I'm going to use this slide actually to get some definitions in. Physical activity is any movement you do, any movement at all that leads to muscles burning energy, that's physical activity. Exercise is something you do specifically planned, structured, and with the aim of improving fitness. And when we say you're improving fitness, there are different attributes that make fitness. Cardiorespiratory fitness, flexibility, strength, those are all the different components that make fitness or go into specific exercises. Now, I put this slide up to actually put, to focus on the word recreation. Dr. Iman was talking about having fun. What is sustainable is what you do in fun activity. And if you can do physical activity that is fun, is more likely going to be sustainable. I will talk about that in a minute. Let me just come down to what are we using when we're doing physical activity? We're using our muscles. Our muscles are the main thing that helps us to move from point A to point B. And talking about skeletal muscles alone is a whole topic on its own. But in terms of the function, these are the basic functions of what it does. It helps you to move. It helps us to maintain our posture. It helps us to maintain and regulate our body temperature. So there are mainly two types of muscles. Generally in the human body, we call it type 1, type 2. One helps you to do slow activity walking around, which is your type 1. Type 2 is what helps you to get and do the 100 meters as fast as you can. But they also get tired a lot quicker. So if you're deep condition, most of your muscles move more into type 2 than into type 1. So you get tired and fatigue a lot quicker. And those are the kind of things you see in people with long COVID. So they get fatigued a lot quicker. And roughly, males have more muscles than females. That's just a genetic factor, nothing other than that. But in terms of muscles, when muscles are active, they do other things apart from movement. And these are the things I want to focus on here. They release certain chemicals, which we call myokines. These chemicals affect every organ in the human body. Every organ. So the movement around is actually part of what makes us and contributes to our well-being. Every organ in the body is affected. And if people can't move around, all this is down-regulated. We see this a lot. There's enough evidence in terms of that. And when we talk in terms of myokine, I'm going to focus on one called interleukin 6 and bring out how this and COVID impacts together overall. So interleukin 6 is a chemical of what we call, I call it the multifunctional chemical. It's at the junction of many pathways in the human body, and it is produced by many different types of cells. The muscles produce it, but more importantly, when we have an infection or there is stress, the body also releases interleukin 6. It is produced via two main pathways. One, through the tumor, what we call tumor necrosis factor alpha. That pathway leads to inflammation. There is another pathway, which is the one the muscle uses, which dampens down inflammation. So the same chemical can go either into inflammatory or it can go into the anti-inflammatory pathway. Exercise tends to push it more into the anti-inflammatory pathway, whereas infections will push it into the inflammatory pathway. So what happens when we exercise, or what happens when people have an infection with COVID? It stimulates the interleukin 6 chemical of the inflammatory pathway. And we know this because interleukin 6 is actually a prognostic factor for people with COVID. So people with very high level of interleukin 6 tend to the ones that end up with respiratory failure and increased mortality. So part of the treatment was to actually try to block interleukin 6 so that we don't end up with overwhelming or runaway inflammation in the human body. So they did different things, and the most popular one is the recovery trial that led to the use of the steroids that we're now using in managing dexamethasone that we're now using in managing patients with COVID. So summary, interleukin 6 involved in almost everything: injury, cancer, infection, but more importantly, when you exercise, your body produces interleukin 6. But think of it like the good type of interleukin 6. So we know when muscles are, it produces interleukin 6 in a measurable amount that doesn't lead to inflammation. So with that knowledge, we think physical activity and exercise is an option to use in patients with COVID-19. Yes, we think so. Why do we say so? Somebody talked about the factors in Nigeria where age might be a factor, might be a contributor to why the number of infections or the severity is quite low. But if you think of Japan, Japan has the highest population of people over 70. They don't have the same mortality as Western societies. Why? So most of the elderly in Japan are physically active. So we do know that exercise boosts immunity. Among some of the other things that exercise does, there is a lot of enough evidence to justify or confirm that. So exercise has an immunomodulatory effect on our body. But what type of exercise? I always say to a lot of people, moderate exercise is good. High intensity exercise can actually go the other way and provoke the body into inflammation. So it's standard adage. We all know this. We say excess of anything is bad, whether food, anything in there. So evidence seems to show very high intensity, very high vigorous exercise can also dampen immunity, whereas moderate exercise actually improves our immunity. So every time you move your muscle, every time you move around, just think of it this way. You're nourishing your bone, you're nourishing your gut, you're nourishing every tissue in your body, and most importantly, the brain. Okay? The currency of the brain is movement. I know Dr. Imam talked about Sudoku and everything in there. Physical activity actually boosts cognitive function at a far higher rate than any other activity. And if you doubt it, I can give you a group of work people who know this in their daily life. So what are the other beneficial effects of exercise? Loads. It's all now what we call incontrovertible. So if exercise is that beneficial, why are we not doing it? The standard usual excuse: time, economy, weather. Dr. Imam talked about people using weather. In UK, we say it's the cold. In Middle East, they say it's the heat. So you see, people always, we have excuses. But all the excuses for not being physically active are actually the things physical activity can help to manage. So if you think about it, these are the benefits of physical activity. If I go into the health, we've talked about it. All the chronic diseases that I talked about, which are the things that make people at risk of developing bad form of COVID infection: diabetes, mellitus, obesity, metabolic diseases. These are things that can be prevented or actually ameliorated with physical activity. We all know people in pre-diabetes can actually be treated completely with exercise. I'm not talking of full-blown diabetes, I'm talking of pre-diabetes before they go into full-blown diabetes. And we know also in terms of mild or moderate mood, exercise has the same effect in terms of antidepressant for mild and moderate, not for severe depression. Severe depression, patients will need medications. Okay. It also helps in terms of blood pressure and everything else, management. What about, I've already talked about chronic diseases. What about physical inactivity? Not being active is actually worse. So if I go to the gym, I'll go and do exercise for 1 hour, and I'll come back and sit down in front of a computer for the 8 hours, I've actually kind of knocked off the benefit of my 1 hour because I'm still going to sleep at nighttime. So sleep 6 to 8 hours as recommended by Dr. Imam, plus the 6 hours of sitting down, that's already more than half of the day doing nothing. So physical inactivity is actually worse. And people who are elderly are less active. In fact, most adults are less active. So one of my former teachers used to say, we don't grow old because of age, we're growing old because we're less active. And we do know this. There's a lot of evidence in terms of that. So if you're inactive, you become easily deconditioned. We said over 65 spend 10 hours doing nothing. Most adults actually spend up to 15 hours a day doing nothing or sitting down. And these are the diseases that tend to come up when people are physically inactive. So computer sounds counterintuitive because most people are actually joining on a computer now. But the more movement around you can do, the better. So what about the physical benefit? Increase your bone strength, muscle strength, and most important in this situation, it helps to reverse aging. Now, I don't know how many of you know this gentleman. This is Charles Ilgster. He's a retired dentist. Well, he was a retired dentist. He's dead now. This picture was taken when he was 90. Okay, that's him in his gym. He died at 93. But up to that, he is a world record holder in almost so many things. He started training at 70 after he retired as a dentist. And this is Ernestine Shepherd. She's 86 now. This was taken when she was 82. 82-year-old lady. So it makes you younger. Then we've already talked about the psychological benefit, it improves people's self-image, people become a lot more self-determined and self-assured. Exercise is primarily one of the factors or ways we become socialized. We talk about socialization by exercise or exercise by socialization. So the people you meet through being physically active are also likely to be people who will share your values and have similar attitude to being physically active. It improves productivity in terms of work and lots of economic benefit in there. Work environments that encourage their workers to be physically active reaps it in productivity improvement, lots of benefit to the workplace and to the employers. And that's why most in the NHS, one of the things we're promoting now is what we call the Healthier Hospital Project, where physical activity is actually encouraged among hospital workers. So how do we do this? There are loads of different theories in terms of behavioral and motivation into getting into physical activity. I do at least 1 hour of lecture talking about behavioral change and physical activity, but we're going to summarize it into 3 or 4 slides. The simplest thing to use is what we call the goal setting theory. You can either go with a SMART goal, we all know what SMART is, or we call it, I prefer Roomba. Roomba stands for the same set of things you have in SMART, apart from the fact that it has a B. The B stands for behavioral. Whatever goal you're trying to set, behavioral goal, so people can actually see the physical impact of your goal. There's no point saying I'm going to be more physically active, but nobody can see whether I'm physically active or not. Why is goal setting important? Because most things we do as human beings is goal directed. So if we set goals, achievable goals, it's easier to follow that through and to have a change. And there is a process, simple process I always say to people who are trying to set goals. In my day job as a rehab physician, one of the things we do a lot is to set goals for the patient for their rehabilitation. So you have to specify what activity they're going to do. We specify what resources we need, how they're going to do it, and what will be the outcome in terms of that. If we're now going to go into prescribing exercise, one of the things I always say to a lot of people is anything you can do, whatever you enjoy, is best to do. If I'm prescribing to patients or to people, we use what we call the FIT principle, which is the frequency, intensity, the type of exercise, the duration, and I always say in terms of the volume, which is a combination of the frequency as well as the time. And then there are some precautions. There are some conditions that will need people to be medically certified fit to do moderate or higher level of activity. So people with cardiac conditions, or people with diabetes, if it's severe, need to be under good control. So there are different modalities we try to, but whatever, the biggest point is the last line on the slide, which is reduce the amount of time we spend sitting down doing nothing. Every exercise session you do should have 3 components. There should be a warm-up, otherwise you're going to reduce the risk of injuries. You do the exercise, we cool down, and after we do static stretching. You don't do static stretching before exercise. I see a lot of people doing that, and I always find it hard to believe that people try to do the static stretching before they actually do the exercise. You need the muscles to be warm for you to be able to stretch it. So it's better you do your warm-up, do the exercise, and you do the stretching after. And there is something what we call the overload principle. Any exercise or physical activity done for less than 10 minutes usually does not translate. You need at least minimum. You can break it down into 10 minutes sections for you to be able to do the activities. It doesn't mean anything less than 10 minutes should not be done. If you've only got time for 5 or 2 minutes, do the physical activity in that period. Or it's better to break it down to do minimum of 10 minutes at any point in time. How do you know about intensity? The simplest I say is moderate intensity, you'll be able to talk, but you won't be able to sing. If you're doing activity at moderate intensity, vigorous activity, you will end up breaking your words in between. So that's the way in terms of knowing. I said the caveats are the precautions we need to monitor and know about if you're going to get people into physical activity. So somebody who's got cardiac condition, or if you've got myocardial infarction, you need to give a few days before they can commence moderate to high intensity activity level. Light activity is just basically what you do in day-to-day moving around. There is no restriction to anybody doing any light activity. There is no medical indication to stop any light activity. I always emphasize to that people on that one. There are no contraindications to light activities in any condition. You move around, try and minimize how long you spend doing nothing. Yes, we talk about people when they have fever or joint inflammation to rest that particular joint, but not the whole body. You still need to maintain the activity to keep things going. And for people who are older, exercise is very good. The risk of injuries is also very low. Like I said, the main thing is to maintain the intensity at moderate or lower level. You don't, unless for people who are already exercising, who are well into the exercise program, you can go on to higher level intensity. So what's the big message? We already know exercise totally. The evidence for the benefit of exercise is now incontrovertible. There is no overwhelming evidence for that. So we already know that. I always say exercise is medicine. Recommendation is for average adult to do 150 minutes of moderate intensity per week. Think of it, 30 minutes every day for 5 days of the week. That's all, minimum. If you can do that, you're within the recommendation of activities. So for COVID, how can physical activity help? It actually puts your body in the best possible shape to withstand whatever is coming. And we need to take that into our day-to-day activity. And it offers a means of control. We like being in control as human beings. When we lose control is one of the reasons why we panic. It affects our mental health and it affects a lot of other things. And that's one of the things physical activity help us to do. And I'll leave you with this slide.
Thank you so much, Dr. Salawu. That was great. It's made me realize that I really need to start getting back on that fitness stuff if I want to have a healthier lifestyle. But, you know, hopefully without a lockdown, we'll be able to do some of those things in a very easy way. We'll be moving swiftly on to our final presentation before our breakout sessions. And this is going to be looking at how we manage our finances during this time. So our final presentation is going to be brought to us by Miss Anne Oragu. She is the head of the Affluent and